I'd like to start off today by asking everyone in the audience to consider what your expectations are when you need to access healthcare. How do you expect to be treated? Do you expect to be heard? Do you expect to be met with compassion and empathy? Do you expect your concerns to be taken seriously? I imagine that many of you in the audience do have these expectations and generally feel quite comfortable calling your family doctor's office to schedule an appointment when you need it. Of course, depending on your health concerns, there may be some level of stress and anxiety, possibly some normal level of fear associated with being unwell or having to have tests done or blood work taken, especially in the midst of a global pandemic. But at the end of the day, I imagine that many of you feel some level of confidence that you'll be well taken care of and have your questions answered. And I imagine you'll feel safe. Unfortunately, for many people who are part of systemically marginalized groups, healthcare institutions are not safe spaces. So what makes hospitals, emergency rooms, and doctors' offices not feel safe for some people? Many people right here in Canada have had the experience of being stigmatized, being mistreated, and receiving lower quality care because of the thickness of their accent, the address on their file, their gender identity, their Indigenous identity, or the color of their skin. Many people expect to be treated poorly because that is what has always happened in the past. I've seen patients in my own practice who share their personal stories and experiences with me and who don't feel safe accessing healthcare. Earlier this year, I met with a patient who we'll call Jean. Jean's a woman in her early 50s. She's a professional working woman here in Toronto, and she's a Black woman. Last year, Jean was diagnosed with breast cancer. However, getting to that diagnosis was not easy. Her symptoms were dismissed over and over again, even with her ability as a highly educated professional to advocate for herself. Once she finally began treatment, she experienced further discrimination when she was stigmatized for attempting to access pain medication despite actively fighting breast cancer. She was called aggressive when advocating to receive standard of care treatment. And now she feels reluctant to present with new symptoms or issues because of how poorly she's been treated in the past. No one who's fighting cancer should have to fight to receive the care they need and deserve as well. Yet this was Jean's experience. This is just one story, but there are countless stories of women from racialized communities facing discrimination in healthcare in Canada. Research clearly shows that racialized groups and people experiencing marginalization experience lower quality healthcare, which can in turn lead to worse health outcomes. Right here in Ontario, we know that women who have immigrated from South Asia are much less likely to be screened for cervical cancer and breast cancer than Canadian-born women. Women with breast cancer who were from the Caribbean wait on average 9 days longer to get their diagnosis than Canadian-born women once they present with symptoms. They wait on average 2 weeks longer to start chemotherapy when it's needed, and they're more likely to be diagnosed at a later stage of the disease. As a researcher and a scientist, both these stories and these statistics fuel my work and are what I'm trying to unpack, understand, and ultimately improve. So why doesn't healthcare work the same for everyone? Well, it's complex and multifaceted, but a big part of it is the factors that are known as the social determinants of health. The social determinants of health are the broad range of personal, social, economic, and environmental factors that determine individual and population health. These social determinants of health include racism, gender discrimination, housing insecurity, and so many more. And the way the social determinants can play out in healthcare is in experiences of discrimination and racism. A recent tragic example is the horrendous treatment of Ms. Joyce Echaquan, an Indigenous woman, in a Quebec hospital. Ms. Echaquan experienced undeniable racism, and it led to her untimely death. Her death is a failing of our healthcare system. As Canadians, we pride ourselves on our universal healthcare system, but many communities simply cannot trust the system, not out of paranoia, but out of the very real and hurtful experiences they've endured, and because of real examples like that of Ms. Echaquan. To address these long-standing issues, our approaches must also be complicated and multifaceted, but that shouldn't stop us from doing the work. And the work must start now. So where can we start? One place to start is with ensuring representation and ensuring that diverse voices are present at all decision-making tables. Let's look at another example to illustrate this point: the shift to working from home during the pandemic. When decision makers were thinking about how to keep people safe from COVID-19, one course of action was to direct everyone to work from home. But what about marginalized communities who are overrepresented among people considered essential workers? People like grocery store workers, personal support workers, retail or food service workers, factory workers, delivery drivers, whose jobs require them to be interacting with the general public or working in close proximity to one another. This map that was published in the Toronto Star highlights in dark blue where the essential workers live who were still expected to be out and about during lockdown. These same regions are where people who are racialized and living with low income are more likely to live. So how do we take care of their health and well-being as well? While work from home is an excellent safety measure for many people, even though all of us here today who are enjoying this event virtually, it doesn't address the needs of everyone. If there had been more equal representation at those decision-making tables, would different or additional decisions have been made to ensure that we are all protected? Entire communities can be overlooked because the appropriate lens, context, and understanding is missing. We know that racialized communities and low-income communities have been hardest hit by COVID, and it's not because of irresponsible behavior. It's because the system has not done enough to protect them. Unless decision makers are representative of everyone, they won't be able to solve for everyone's needs. And the same is true for healthcare. A colorblind approach simply doesn't work, and cognitive diversity is essential to creating equitable systems. Let's consider how this lack of representation has played out in the history of health sciences and medical research. In 1978, only 11% of doctors in Canada were women. In 2018, that number had gone up to 42%. Now, we clearly see how problematic that 11% was for women and women's health. There simply wasn't enough representation. There's still much work to be done when it comes to gender bias in healthcare, but we're making progress. But we need to increase representation across all facets of people's identities. For example, 5% of Ontario's population is Black, but only about 2% of physicians here are Black. We see similar disparities among health researchers. We need meaningful commitment and action to increase the number of diverse healthcare leaders and researchers who in turn influence policies and health studies to improve health outcomes for diverse communities. Without diversity of researchers and decision makers, who also bring their own lived experience to the table, it will be impossible to address systemic issues. Without that diversity, we simply don't have all the best minds at the table, and that hurts us all. That's why the Women's College Hospital Foundation has established the Emily Stowe Society, which focuses on removing financial barriers for students from marginalized communities that are underrepresented in the health sciences. The Emily Stowe Society has a mission to help these brilliant students advance in their research careers, for them to know that if they see it, they can be it, and help to ensure that everyone is represented in the halls of research institutions of the future. Another way that we can build a better healthcare system that works for everyone is by centering on the margins. This is a concept that comes from Black feminist bell hooks and works under the philosophy that when you focus on the center, where the people with power exist, the people at the margins are left further and further behind. But when you center on the margins, you're prioritizing the unique experiences of those people who may be marginalized, and you're developing care pathways and resources that remove barriers to care for them. When you center on the margins, you create a system that's capable of working for everyone. Let's look at some examples from our own work here at the Peter Gilgan Centre for Women's Cancers at Women's College Hospital. In partnership with the Canadian Cancer Society, we recently launched an exciting new program called Better Women. Better Women is an evidence-based peer health coaching program supporting women aged 40 to 65 to take control of their health so they can prevent chronic diseases, including cancer. A unique component to the Better Women program is a section that's specifically dedicated to supporting South Asian women who we know are at higher risk of chronic disease. Research shows that a peer health coaching model in particular has been proven to work well for people from marginalized groups because it removes that hierarchical relationship that often exists between a patient and a care provider. Instead, the relationship can start from a place of trust and a sense of community. This means people are more likely to stick to their goals because they have the support of a peer who they know they can lean on and trust. At the Peter Gilgan Center, we're also focused on improving cancer care experiences for Black women. We know that Black women, like Jean, often experience poorer health outcomes following a breast cancer diagnosis. They often can feel left out of current supports and materials that have been developed for women with breast cancer. So to combat this, we are developing resources to help to support and empower Black women along their breast cancer journey. When women can see themselves represented in materials, and when those materials are created specifically with them in mind, they're more likely to feel supported, to be empowered, and to know that they're not going through their journey alone. A final project that I'd love to share is focused on understanding disease prevention in low-income communities. The relationship between income, health risks, and outcomes is clear and well-established. Research shows that if you're from a low-income community, you're less likely to be able to access healthy foods and exercise facilities. You're more likely to have multiple chronic conditions such as diabetes or heart disease, and you're more likely to die at a younger age. So many health outcomes can be improved by committing to healthier lifestyle habits, but this can be an insurmountable barrier for some. Which is why we're working in close partnership with Durham Region Public Health to help young adults make achievable, healthy lifestyle changes. We're helping them set their own goals based on their individual context, and importantly, helping them to address those social determinants of health that may be holding them back from better health. We're committed to these projects and others like these that center on those on the margins. And importantly, for all these projects, we're ensuring that there are community voices at the table. When we can bring necessary cognitive diversity to the research bench and the decision-making table, we can better serve everyone. Health research that shines a light on the unique needs and experiences of marginalized communities that directly incorporates their voices leads to better and more informed care. Because a system designed to reach the most marginalized will reach everyone.